Man, I tell you, welcome everybody to my live. Technology has its way of making you like, should I even really be doing this and should I be going live because of the technical difficulties that we have with technology. But I'm learning even through my own, journey through social media. Just slow down, take a breath, and put it up anyway. It'll come anyway, So just slow down. So not only am I here to encourage and empower you and enlighten you, it is also very humbling and encouraging for myself because of the woes of technology. But for those of you all that are new to my channel, thank you. My name is Tiffany Hodge. I am a MSW, LMSW in the state of Georgia and South Carolina, and you have given me this space to come in into your world, into your ears, into your eyes, and I appreciate it. And my channel is all about providing basic mental health education to everyday people. Um, I started about 7 years ago. It's been a long time, but to really come in and just teach basic what is mental health, how is it working, hopefully giving you some tips and tools and some techniques that you can try, but providing that foundation of education for you is my main objective. If you have any comments or questions that you want to ask, you can ask them in the chat. I do know that sometimes it is, as much as we're talking about mental health, it may be a taboo topic. And so you might not want to add things in the chat or say things in the chat. And I totally respect that privacy. So if you would like to just stay connected with me outside of this platform or any other social media platform that you're following me on, go ahead over to my website and sign up and subscribe to my newsletter. In that newsletter, you get a chance to really connect with me and ask those questions that you may have. Remember, you won't get a therapy session in an email, but you can ask me very generalized questions, and I'll be more than happy to help you and get you to the resources that you already have. I always make this disclaimer before starting any live or anything that I'm doing. If you are currently in therapy, please continue to work with the therapist that you are working with currently. My material and what we are doing on this live is basic education, and it is not a substitution if you are already currently working with a mental health professional. Okay, please continue to work with them and continue to grow and thrive and do the work that is required of you to be the best version of yourself. If you're listening to this after the live, thank you. If you're listening to this on my podcast, catch this now. I'm excited that you have caught it at all, and I'm super excited that you have given me a few minutes of your time to just give you some basic information. And tonight, we're going to talk about depression. It might not be the best topic, but this heat is depressing. Technology can be depressing, and all these other factors that may come up can cause some depression. So we're just going to give some basic definition of what it is, give you some symptoms, maybe the cycle of depression, and we're going to give a little twist here. I'm going to give you ways that you can support someone that may be experiencing depression. Another thing that I find to do in my community is teach families about how it looks to support someone that may be, say, dealing with depression or dealing with anxiety or anything that we'll be discussing. So I may flip flop between actually giving you some things that you can try for yourself, but I also want as you may be supporting someone that may be experiencing some of these signs and symptoms, I want to be able to give you some ways that you can actually support them. Because again, we know everyone is not going to come to therapy, and that's okay. But I do believe that everybody should have the basic working knowledge of what these things are, such as depression, anxiety, and things like that. If you have any questions or comments, you can put them in the chat. Also, want to do another little housekeeping. I think August 10th, it is August 10th, I will be having a virtual a dating with kids workshop. I'm excited to actually teach some techniques and some strategies and what that looks like. I was a teen mom. I know what that looks like, and I know what it's like to have children and trying to be on the dating scene. So I came up with a nice workshop that if you're interested in, come on, head on over to my website and you can purchase your seat there. Space is limited. Also, if you are a social worker or a mental health professional, it is our renewal season. Don't leave off those three core CEU hours that I'm presenting and I'm offering on revitalizing and recharging professionals in burnout. So that's also a virtual event. I have dates left in August and September. You can head over to my website and check that out. And last housekeeping note, make sure if you have not subscribed to my YouTube channel or you are not getting the newsletter, please make sure you head on over to my website to get that newsletter so you can get those 10 free self-care journaling prompts. From what I hear, they have been very beneficial to people and they're using them and they're finding them very insightful and helpful on their journey. It is absolutely free. Make sure you head over there and get those tips. If you hear my fan, it's because something's going on with my ear. And we're going to get that fixed. But, the show must go on. And I'm excited to be here. All right. Depression. you know, Depression is a tricky thing. Um, I was going to go into this really big spiel about it, but I decided let me just keep it very basic and very just straight into the point and very, hitting these key points that you may need to know as it relates to depression. Depression is it is typically when you're having like some form of distress, right? We have some stressors going, we have some things going. Remember, there are different forms of depression. I'm not going to actually get into that, but just know that there are different forms of depression. I would call it levels, right, to depression. Also keep in mind that in order to be diagnosed with a depressive symptom or to say, what, we are having some depressive episode, these symptoms need to last for at least 2 weeks. So thinking about that loved one, because we're going to actually put you in the seat as being the family member that may be working with someone that may be experiencing these things. And so here's some things that you want to look out for when depression may be on the rise. Remember, these symptoms need to last for at least 2 weeks. We're not talking about people that have diagnosis with a depressive disorder. Okay, let's keep that in mind. We're just talking about depressive symptoms. If you have been diagnosed with major depressive disorder, and anything of that nature, please continue to seek the mental health counsel of your therapist and your psychiatrist or your psychologist that you are working with. But some of the symptoms that may come up that you may recognize in your loved ones or even within yourself: depressed moods. You may have difficulty sleeping. Loss of interest or pleasure is a really big one. We tend to notice people tend to stop finding joy in the things that bring them pleasure. Fatigue nearly every day. And sometimes, some of these things can be enmeshed in other things. So keep in mind that, if that, your job and the kids and all of these things and environmental factors can play into why we may be experiencing some form of depression. But remember, the key term here is it has to last for more than 2 weeks or at least 2 weeks. That's the key. We need a duration. Okay, significant weight changes. You may gain weight, you may lose weight. Some people stress eat, some people, don't eat at all. And so if you're noticing that, my loved one is not eating as much or they're gaining weight and it's like at a rapid rate and something may be going on. Feelings of worthlessness, I'm just not good. I'm not, I don't need to be here. Those type, well, if they say I don't need to be here, we need to actually go a little deeper because that may be some type of ideations, and that's another subject for another day. But that just that feeling of I'm not good enough. you know, even if you find that within yourself, or you find that within the loved ones that that you may be caring for and you live with, diminished concentration, not being able to really concentrate on things that you or your loved one may typically have been able to concentrate on. Those are some of the symptoms and the signs that you may be experiencing some depressive episode. Recurring thoughts of death. I mean, I know we don't like to talk about death, but we have to be honest and open about things that are inevitable. And one of these things is, depression can bring that thought up. But again, if we get into too far where, I'm better off not being here and all of these things, we really need to be seeking some emergency services for someone, because it may be a suicidal ideation. But a lot of people, believe it or not, when they're thinking about um, completion of suicide, they are really depressed. So depression can be a really big red flag when we're looking at people and thinking about how people talk about suicide and how it is committed or completed, if you will. Let me say that, the completion of actually going through with the act. And depression does have um, some leeway in that. So you want to keep eyes on yourself, and even if it's a loved one, especially if they're having those reoccurring thoughts, what plans are we doing to actually get you into some services with someone? Remember, these must last at least 2 weeks. you know what is the plan and what do we do? If you take what we call a PHQ-9, is a patient health questionnaire. It's 9 questions, and it rates where you are over 2 weeks, and it gives you that gauge again, like we did with the anxiety, which was a generalized anxiety disorder questionnaire we talked about last week. This one is a PHQ-9, and it rates your depression symptoms, and that will let you know, okay, hey, I may need some help. Hey, I may need some modifications. Hey, I may be able to kind of work through this on my own. And then, hey, I'm at a level where I may need to get some medication, or I may need to be speaking with somebody on a regular basis about these thoughts and these feelings. So keep in mind that those are just some of the symptoms. It's not a I didn't give a blanket list. I did not go over everything. I'm sure there are plethora of other identifiable cues that can go into what depression may look like. And keep in mind, it looks different for everyone, and it looks different for every culture. um, what an African American may look like in a depressive state may look different from a white person, or an Asian, or someone of Hispanic descent. So keep in mind that depression looks different in each and every one of us. But some of these that I just went through are kind of the blanket of it. Even if you're thinking about Native Americans, they the they may always be in a depressive looking mood, according to what I just said. But knowing that culture, understanding their culture is very important. And that's why I highly recommend, if you are seeking therapeutic services, you are doing it with a professional, because we are licensed, and we do have cultural competency trainings that we must adhere to in order to actually service the community that we are in. I cannot stress that enough. Giving you some little demographics here: women are 2 times more likely to develop depression. Go figure, right? Women are and I'm going to say, I don't know if men aren't asked the questions as much, but women maybe present more to trials and studies and things like that. So maybe this is where this research may be coming from. But hopefully, men are actually engaging with their primary care providers, and they are actually being tested and screened for these, because I am sure men have a lot of depressive episodes. We just might not be tracking it as much as we do women. That's just my personal take. About 1 in 10 people will experience depression during their lifetime. Most people experience their first depressive episodes between the ages of 20 to 30, right? Because at 10 years, a lot is happening. You know, you just jumped off the porch of leaving school, high school, getting ready for college, whoop de whoop. And then you're trying to, navigate through that space. And then boom, here you are, you're at 30 and everything isn't where it's supposed to be. So we may have some age in there where some time in there, excuse me, where this depressive episodes can be very, 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 very prevalent. We do have some risk for depression. You may have a family history of depression. It is so good to talk to your family about family history. I know sometimes we don't like to talk about these things because it's in the past and we don't overcome and all this. I get it. But in order to understand where we are, we must know where we have come from. And it is not a slap in the face to talk to your family about, did grandma suffer from depression? Did grandpa suffer from anxiety? Or, back then the terms were different, but, you can kind of figure it out. Were they sad all of the time and things like that? So keeping that in mind, don't be ashamed of your family history. Please talk to your family because it does help paint a better picture for whatever clinician you may be working with to help you identify, is this depression or is it something else? Poverty, unemployment, social isolation, and stressful life events. Everything in America right now: poverty, unemployment, social isolation, and other stressful life events. COVID was a so depressing for not for all. Some people really thrived in it, but some people really, became very depressed in it. That social isolation is real, and I think we are still, again, as I talked about even in the last session about anxiety. I think we are now just going to see the effects of what COVID really did on our mental health as it relates to depression. Are we really engaging like we used to, or are we still stuck in this technology way of communicating and getting these things out? And how is it affecting us? Emotionally, if you will. Remember, you may have some chemical imbalances. We talked about in the last session about that dopamine and that serotonin. Those things also play a very big part in the depression and how it can manifest itself. Okay. And regular drug and alcohol use. Sometimes we drink the pain away, but are we really drinking the pain away? Do you notice that in a loved one that they may be drinking a little bit more than usual? They may be doing more drugs than usual than what they typically would do. Is something going on in that? Are we overeating? Things like that. Are we stress eating and things of that nature? All of those things can give us some indication that maybe we may be having ourselves or the loved one may be experiencing some depression, and these are some risk for depression. If you are regularly using drugs and alcohol every day, you may put yourself at risk for developing some forms of depression. How do we treat depression? Two ways. We do psychotherapy, where you come in and we do what we call CBT, cognitive behavioral therapy, and you talk and they challenge your thoughts and things of that nature. And sometimes you may need some medication. Um, they work hand in hand. I will always try to remind you of that. Some people are just like, I don't want to take medication, and that's okay. It is your right to decline medication. But I always recommend, if you're going to do psychotherapy, that means I'm going to talk to somebody on a regular basis. I might need to see if I need something to help regulate. You can try other methods such as meditation. There are some whole natural things that you could do: changing your diet, going to bed on time, trying to get a different sleep pattern, choosing better friends. Maybe your job is depressing, and how can we navigate that? So really working with someone to help you create and craft that plan can help you mitigate and manage and maintain, if you will, those episodes to a minimum until you're able to make an adjustment. If that say if the job is the issue, until you are able to mitigate that, how can we set up a plan to where we can actually work through this so it is not so depressive for me. Okay. Some other cool factors that I found out too is that over half of the diagnosis with depression also suffer from anxiety. Again, you have that comorbidity. That's what we call, where it's like, you got more than one thing going on. But I always found that fact interesting. And physical exercise can help, has been found to help with significant antidepressant effect. Go and get that blood moving. Again, we got a lot of energy in our bodies. We did sit down for I think a year with COVID. So we got a lot of stuff built up there, and we may be able to move some things around to get some clarity, getting some fresh air. It is extremely hot. So you want to kind of plan that exercise outside, make sure you're hydrating, and get your blood work done as well, because something could be going on that could be causing you to feel depressed in the body. 60% of those who die by suicide suffer from depression or a related mood disorder, as I talked about earlier. But there's that number, is 60%. So that's why we don't want to take any depressive episodes as a minor thing, or oh, they'll get over it, or we really want to help. And I'm going to give you some tips on how you can actually support someone that may be going through depression. But I want to give you the cycle, because everything is on a cycle. The moon is on a cycle. Childbirth is on a cycle. Everything is on a cycle. Okay. And so when we think about the cycle of depression, it's typically a stressor. Number one, it's always some stressful event, something hard, something that's happened. It could be long term, it could be short term. And then what happens? We also get these thoughts, we get these feelings, and then we get these physical symptoms. So the stressor often causes a negative thought. That's why it's important, when you're going through some things, don't go through it alone. Try to get somebody that can help you process through where you are, and talk about it. Not someone that's just going to okay you and kind of just go along with whatever you're saying, but someone that's going to actually challenge you to look beyond and really try to push the way that you're thinking. And sometimes people may go to their pastors, or they go to coaches, but if it gets extremely bad, please make sure you are seeking help from a mental health professional. Some examples of the thoughts is, I might not be perfect, nobody likes me, I'm not good enough. Those are some of the things that typically start to ruminate in people's minds, when the stressor comes, and then those thoughts come, and then here comes these feelings of hopelessness, and I'm lonely, and anger and sadness, and vice versa. So you get all kind of things going on within the body. That's that. When I say feelings and emotions, I'm talking about the release of the neurotransmitters in your body. You have serotonin, dopamine, adrenaline, norepinephrine. Please make sure you look those things up so you can familiarize yourself with what is actually going on in your body and how they play on these emotions. Okay, that's what we're gonna call them, right? Then you may have some physical symptoms because you're ignoring the triggers that's going on in your body, or excuse me, or the signals. Let's call them. They're not triggers. They're signals. The signals that are going off in your body, you may be ignoring them. Will get better. So your body has to give you some physical symptom. It has to give you something. So like fatigue, you're exhausted. You may have sleeping problems, poor concentration, loss of motivation, because now your body is trying to say, hey, because we ignore our internal signals, and then we just and the body is still trying to say mayday, mayday, mayday. So we have to do something. So the body is a beautiful design piece of equipment, if you will. And it starts to do all these things where we lose concentration, we don't have any motivation, we are extremely tired, and we're fatigued. So here's the stressor. First, here's the thought. We didn't address the thought. Here come these feelings, the firing off or the lack thereof of our neurotransmitters. And then we have, okay, we've ignored that, and now here we are, our body is now physically making us symptomatic, so we can do something. You must do something. And typically what happens in depression, we don't typically go to the positive, if you will, or the motivating thing that help us get out. We tend to typically social isolation. We go to drugs and alcohol, and we neglect our daily task. We just want to sleep the day away, those things. And if these things are persistent for more than 2 weeks, then we really need to get some help, and we really need to support those that may be experiencing these. I'm going to give you about 5 things that you can do to actually support someone that may be experiencing depression. Remember, it's something that all of us may wave in and out of it. But the key thing that I want you to take away from today is that these symptoms last at least 2 weeks. I think I put no, I didn't, and I'll put it up on the other one. But I'm going to put up the PHQ-9. It is free to do. It's free to do, and if you do it and you see, oh wait, I need some help, please contact. If you currently are working and you pay health insurance, you have what we call EAP. You have employee assistance programs. Please look on the back of your insurance cards. Call people and say, hey, I took this patient health questionnaire and it is not looking good for me and I need some help. I need to be evaluated a little bit more. You must advocate for your own mental health, people. We don't know if you don't tell us. We just don't know. But imagine if you go in and you say, hey, I've done this for myself and it's not, I didn't do well and I need some help. Can you help me? And that's how you can get those resources. Even if you don't have insurance, and you may go to your local health department and say, hey, I need to speak with somebody because I took this on my own and I'm not doing well and I really want to understand what's going on and how I can navigate through that. Even if you take it to your pastor and say, is there anybody in the church that can help me? But you must do something, people. You got to do something because we don't know. So that's why I'm giving you this resource to say, this is how you can identify it and this is what it looks like. Then I'm actually giving you what you can do on your own independently. You can print this out and you can take it. You can also do a mood tracker, which is on my website. You can download that and track your moods. But you have to be able to present something to say, hey, this is what I have been doing, and this is what's going on. You have to do the work in order for it to be successful in any type of therapy or mental health that you're working with. You have to do some work, and I hope that you take what I'm saying and you really try it and really present it to your mental health professional if you've never taken one, or if you have an EAP. Sign up for that to get some assistance, or look at those local resources in your community that can help you with mental health if you do not have insurance. But here are some ways that you can support someone with depression. Take any mention of suicide seriously. Symptoms of depression include intense sadness, despair, and thoughts of suicide. If someone is in danger, please dial 988 option 1 on your cell phone, or you can take them to the closest emergency room in your area. Please take every mention of it seriously. Sometimes, oh, well, he just joking. Well, we don't know. And I often have to advise clients, don't joke about that, because I know, it's our way of getting through and getting by. We joke about things like that, but we have to take everything as though it is serious. And so I ask a lot of people not to joke about that. If you really feel that way, then what can we do to help you? And ask them. You can say that, hey, if you really feel that way, how can I support you? And do that. Or, hey, if you feel real bad before I leave here, here's the number. Make sure you call it, or you call me. Do you need me to stay with you? Do you need me to take you to the emergency room? We must take every mention as serious as life, because we don't know if people are joking or not. So I try to educate people not to joke about that, because sometimes it starts off as a joke and it really does happen. Um, Again, I always say make time for self-care. Self-care is a big one. Make sure you go over there and you download that self-care 10 journal prompt so you can see if you are actually taking care of yourself. There's also a self-care assessment that's located on the website. Make sure you take that to see where the areas that you may need to improve. But please make sure you are attending to yourself every day on a daily basis, and make sure the person that You may be your loved one. Make sure they're doing it. If you don't want to download it for yourself, download it for a loved one that may need it, and help them do it and help them right through that, and watch and see how that will actually start that motivation and moving them into doing something. Um, Connect your loved one with social supports. There are so many social supports out there that there are so many groups. You can Google it. You know, we got $1 million phones here. You can Google support groups for depression in my area and see if there is one there. If there isn't one, and it'd be great to start one, to start a support group. You can do that. Make sure you're checking though to see if there is one in your local area that may be started by a professional, or you can, because if you started or the loved one starts it, that's a support group, because we're all in commonality. We all have things in common, and we can share ideas of how we are managing and maintaining what we are experiencing. And also, if you can't do anything else, just listen. Listening helps. Sometimes you don't have the advice and you don't have the answers. We don't have all the answers, but we do have two ears that is able to listen. And sometimes we just need to be a listening ear for someone to sound it off. Because believe it or not, in talking, people can and do sometimes find the answer that they are looking for. So if you can't do anything, you don't know the right words, just say, you know what, I'm here to listen, if you need someone to just confide in. And when they confide in you, please keep that between you and them. Keep that very confidential, because it can destroy a relationship sometimes when people are sharing their deepest thoughts with us, and then we're going out and we're telling them, right? Have a code of ethics in your friendships and the things that are discussed with you, because by law I have to have it, right? But have it by law in your code of ethics of friendship, and honor that. Be supportive of healthy habits. If you know what, they're not drinking anymore. Okay, don't pick. Well, I remember when you used to get down. Well, they ain't getting down no more, right? We're going to support them healthy habits, and we're going to try to not make sure that we're putting people in a situation that will make them go back and revert back to a habit that might have caused that depression. So keep that in mind. I can't invite them here. Not a bad thing. It's because I want to make sure that I'm supporting them in a healthy way. And you may want to be able to reiterate that with them. Hey, I didn't invite you because I know what you're trying to do and I want to support you. And I don't want to put you in a situation where it's going to cause you to revert back to something that I know you're growing from. So, think about how we're going to communicate that. And keeping them on those healthy habits. And last one, I want you to be able to recognize that depression is an illness. Just like a cold or a flu, a person cannot simply choose to get over it. They cannot choose to get over it. Okay? Please know depression is real, and it can affect anyone at any given time. It knows no color. It knows no gender. It knows nothing. It just knows how to exist, and it will. And a person can develop it even if they have a good life. You know, it doesn't mean you're poor and destitute all the time makes you depressed. There are a lot of people that may have a good life and they are yet depressed. They are socially isolated as well. So we want to keep that in mind when we are supporting those that we love. I hope you found this helpful. If you have any questions, you can put them in the chat. Again, make sure you have your notifications on here if you're going to watch this live with me on YouTube. If you're going to catch this later on the podcast, catch this now. I thank you. Make sure you have subscribed and you can leave your comments on that platform as well. My nose keeps itching. I don't know what it is. Every time I go live, my nose does that. Okay. But make sure that you've subscribed. If you have any of the worksheets and you want to discuss it in the group, I have a private Facebook group called Tiffany's Table. You're more than welcome to go in over there and join and get your questions asked that way. Again, if you have signed up for my newsletter, you can always email me any questions that you may have about anything that I have discussed today. I will put the PHQ9 link up for you to look and review. If you see it's not there and you know me and you want to DM me and say, hey, you didn't put it up, please let me know because sometimes I do forget. But I want you all to continue to be the best version of yourself. Thank you for giving me the time to come in and teach a little bit about depression, the cycles, and how you can actually support someone or yourself if you are experiencing any of these symptoms. Remember, they must last for at least 2 weeks. Remember to again take care of yourself. Next week, funny story. I'm going to talk about emotional regulation, and what that looks like, and how, yeah. So I'm excited about that. We're going to do some emotional regulation stuff. Just giving an overview of that. So make sure you tell your friends next week. I think what's next Wednesday? Next Wednesday is, I don't know what next Wednesday is, and I don't have. Oh, well, whatever the date is. I was trying to look at a calendar. But whatever next Wednesday is, if as long as it's not July 4th, no, because July 4th is on a Thursday. So I will see you Wednesday at 7 o'clock. We're going to do some emotional regulation. Remember to continue to educate yourself. Remember to continue to engage, right? And take the enlightenment as it comes. I'll see you guys next week.